He hadn't left his room in almost a year. The blinds stayed shut, the door locked. Light hurt, noise startled. Most days, he lay on the floor because the bed felt too soft, like it was trying to swallow him. At night, voices curled through his skull like smoke, accusing, mocking, warning. Doctors called it schizoaffective disorder, a diagnosis with a long shadow, mood swings that stretched from euphoria to despair, hallucinations, delusions, 18 years of medications, antipsychotics, antidepressants, mood stabilizers. Nothing had pierced the fog. He'd tried everything they offered, except peace. He used to be a musician, played cello in a local orchestra, taught lessons, wrote scores for short films. But eventually, the music faded. The strings collected dust, and the silence, his silence, became unbearable. Until one day, desperation made him say yes to something strange. A diet, not a cleanse, not a meal plan, a full metabolic reset. No sugar, no bread, no fruit, no starch, nothing the brain could convert into its usual fuel. Just fats, protein, water, and salt. Monitored, measured, strict. A medical ketogenic diet, like those used for epilepsy. The kind of thing neurologists prescribe to prevent seizures. It made no sense. But nothing else had worked. So he agreed. And something happened. Not at first. The first 2 weeks were worse than hell. His cravings screamed. His body shook. His mind rebelled. But then, on the 3rd week, the voices softened. On the 5th, he started walking outside. On the 7th, he picked up the cello, and by the 3rd month, he smiled. Not once, not forced, but daily, spontaneous, real. His psychiatrist, who'd known him for nearly a decade, was stunned. The man who once couldn't hold a conversation was cracking jokes, asking questions, making plans. By the end of the year, he was off medication entirely, stable, independent, composing again. No one could explain it, except they could. Because something had shifted, not in his mood, but in his cells, his neurons, his metabolism. The brain that once ran on chaos was now running on ketones, clean, stable energy. The fire had been inside the engine all along. It just never had fuel that worked. And he wasn't alone. There were others, dozens of them, different diagnoses, same outcome. A woman who had tried 9 antidepressants over 12 years, who found freedom in ketosis. A young man with crippling anxiety who hadn't slept through the night in 5 years, whose first full sleep came 2 weeks into a dietary protocol. A teenager with bipolar disorder who stopped cycling between mania and despair the moment processed sugar left his bloodstream. No magic, no miracle, just food. Food changed their chemistry. Food calmed their minds. Food, real food, did what medicine couldn't. Because what if the poison wasn't just in the mind, but on the plate? What if the wrong meal could mimic madness? What if everything we've been told about mental illness is true, but incomplete? What if the brain isn't broken, just starving? And what if the cure doesn't come in a bottle, but on a fork? Are you sure you know what's feeding your mind? He didn't start as a rebel. He started as a believer. Dr. Chris Palmer was trained at Harvard. He followed the protocols, prescribed the meds, referred for therapy. He did everything the psychiatric textbooks told him to do. He knew the side effects, knew the risks, but he believed in the system. Or at least, he hoped it could work. Then came the years, and the patience, and the pain that wouldn't lift. Week after week, he saw people come in with hollow eyes and shaking hands. Diagnosed, dosed, sent home, then back again, still suffering. Some improved a little, most plateaued. Some got worse. Many never got better. I started to ask myself, he says, why can't we do better? Because it wasn't working. Not really. We have all these medications, all these theories, and still, so many of my patients were stuck. They weren't healing. They were surviving. Palmer's frustration didn't come from failure. It came from watching others fail. The woman who cycled through 15 antidepressants. The man who could barely speak through the fog of side effects. The teenager whose hallucinations worsened after every increase in dose. And he kept wondering, why isn't psychiatry curious enough to look beyond the brain? That question stayed with him, even as his own health began to crack. In his 30s, Palmer was overweight, pre-diabetic, chronically tired. He followed the advice he gave his patients: eat less fat, exercise more. But nothing worked. The spiral deepened, until, out of frustration, he tried a low-carbohydrate diet. It was supposed to help his blood sugar. What happened instead stunned him. My mood changed, he recalls. My concentration, my sleep, my energy. I felt like a different person. He hadn't expected that. It was supposed to be a metabolic fix, but it lit up his mind. And in that moment, a seed was planted. If food could change me, what could it do for them? The opportunity came in the shape of a man he'd treated for nearly a decade. A middle-aged patient with schizoaffective disorder, part schizophrenia, part bipolar. For 8 years, Palmer had tried everything. 17 different medications, combinations, titrations, therapies. The man was still hearing voices, still delusional, still unable to function. Out of options and inspired by his own shift, Palmer offered something no psychiatrist had ever mentioned to this man before: a diet, a strict, medically supervised ketogenic diet. It wasn't for mental illness, not officially. It was originally suggested for weight loss. But Palmer had a hunch. If food changed his own brain, maybe it could shift this one too. The patient agreed. They began the protocol, and then something broke. Not the patient, the cycle. Within weeks, his hallucinations started to fade. Within months, he was thinking clearly, talking clearly, engaging with the world. For the first time in over a decade, he could work. He could live. Eventually, he came off all medication. Palmer couldn't believe what he was witnessing. "This isn't supposed to happen," he said. "People don't recover from schizoaffective disorder. Not like this. Not from diet." But it did happen. It happened right in front of him. And that moment shattered something inside him. Something old. Something he hadn't realized he'd been carrying. "I was trained to see mental illness as a lifelong condition, something you manage, not something you cure." But here was a man, free, not from therapy, not from pills, but from a shift in metabolism. That single case redefined Palmer's mission. He could no longer see psychiatry as a system of symptom control. He began to see it for what it was, a field that had stopped asking why. And when he finally did ask why, the answer changed everything. Central belief of Dr. Chris Palmer. For over a century, psychiatry has hunted for ghosts, chemical imbalances, faulty genes, childhood trauma. Each theory promised an answer. None delivered the cure. Chris Palmer thinks we've been looking in the wrong place. Mental illness is not a chemical imbalance. It's an energy imbalance, he writes in Brain Energy. The breakthrough came when he stopped viewing psychiatric disorders as distinct labels and started seeing them as signals. Different symptoms, yes, but one shared origin: broken energy production in the brain. At the center of Palmer's theory is a small, unglamorous structure you learned about in high school biology: the mitochondria. They are more than power plants. They are gatekeepers of mood, memory, emotion. Your mitochondria, Palmer says, are the power plants of your personality. When they fail, neurons starve, circuits misfire, thought collapses, and the mind, your sense of self, begins to fracture. He calls this metabolic psychiatry, a new field rooted in an old truth. Every brain cell runs on fuel. That fuel is ATP, adenosine triphosphate, and mitochondria are the engines that make it. When they work well, we think clearly, feel stable, sleep deeply. When they sputter, everything breaks down. Attention, impulse control, motivation, emotion, memory. What we call depression, anxiety, bipolar disorder, even schizophrenia. Palmer believes they're all symptoms of the same invisible failure. The brain cannot make enough energy to function normally. In Brain Energy, Chapter 2, he puts it bluntly. Symptoms can be highly variable, but mitochondrial dysfunction is both necessary and sufficient to explain all the symptoms of mental illness. It's a bold claim, but one that ties together decades of fragmented science. Because mitochondria don't just make energy, they also regulate the very chemicals psychiatry has spent decades trying to adjust: serotonin, dopamine, GABA. They influence hormone levels, inflammation, gene expression. When mitochondria fail, neurotransmitters become unstable. Inflammation rises. Synaptic function breaks down. The result isn't just fatigue, it's despair, paranoia, mania. Palmer writes, "What we call psychiatric is actually metabolic collapse at the cellular level." This explains why people with serious mental illness are far more likely to have diabetes, obesity, heart disease. It's not a coincidence, it's convergence. A body struggling to regulate energy shows it everywhere, including the mind, and brain scans reveal the damage. People with depression show impaired glucose utilization in the prefrontal cortex. Those with schizophrenia show metabolic abnormalities in the hippocampus and thalamus. Bipolar disorder, PTSD, OCD, all show mitochondrial signatures. Palmer's theory doesn't dismiss trauma, genetics, or environment. It integrates them. Stress? It elevates cortisol, which inflames mitochondria. Trauma? It activates the fight or flight system chronically, draining cellular reserves. Genetic vulnerability? It often shows up as impaired metabolic pathways. Everything, every risk factor, funnels through the same bottleneck: energy. And that's what makes this theory so powerful. It's not just about blame, it's about leverage. If you can restore the brain's ability to make energy, you can restore its ability to heal. In Chapter 3, Palmer writes, "Once people understand the big picture and the detailed science, they will see that all of this has been hiding in plain sight." So why haven't we seen it? Because psychiatry has spent decades categorizing symptoms instead of decoding causes. We label what we don't understand: depression, schizophrenia, borderline. But what if these aren't separate diseases, just different manifestations of the same dysfunction? That's the quiet revolution of metabolic psychiatry. It doesn't ask, "What's your diagnosis?" It asks, "How is your brain fueling itself?" And if we've been medicating symptoms of starvation, if we've been chasing imbalances downstream of a deeper failure, then the entire field must confront a terrifying, exhilarating question. What if we've misunderstood the root cause all along? Core Teaching 1. They are small, silent, almost invisible, but inside every brain cell, mitochondria are working, turning oxygen and nutrients into fuel. They are not just batteries, they are architects of thought, memory, mood. Mitochondria are the regulators of neurotransmitters and synaptic plasticity, writes Dr. Chris Palmer in Brain Energy, Chapter 4. That means they don't just supply energy, they control how brain cells communicate, how emotions rise and fall, how you learn, adapt, and recover. When mitochondria falter, the system collapses from the inside out. Without enough ATP, neurons fire unpredictably. Signals get delayed or dropped. Circuits become unstable. The result? Cognitive fog, low motivation, mood swings, sleep disturbance. What looks like depression, what feels like anxiety, is often the brain running on fumes. Palmer calls mitochondria the power plants of your personality. They are the difference between presence and disconnection, between clarity and chaos. And they are deeply vulnerable to inflammation, to sugar overload, to chronic stress, to toxins, to nutrient depletion. Chapter 5 of Brain Energy lays it bare. When mitochondrial function drops, the brain loses its rhythm. It can no longer regulate neurotransmitters like serotonin or dopamine. It struggles to calm the immune system. And it cannot support the flexible plasticity required for emotional recovery. It's not just dysfunction, it's disintegration. But here's the revelation. This dysfunction is often reversible. When you feed mitochondria the right inputs, healthy fats, ketones, antioxidants, movement, rest, they begin to recover. They stabilize, they regenerate. And when they do, so does the person. Mental suffering, Palmer suggests, is not just in the psyche, it's in the power grid of the brain. And for many, that power has been flickering for years. We've blamed the symptoms. But it was the spark, quiet, cellular, mitochondrial, that was failing all along. Core Teaching 2. He had lived with schizoaffective disorder for over 20 years, 17 different medications, countless hospitalizations, daily hallucinations. His life had narrowed to survival, no work, no friends, no future. For 8 years, Dr. Chris Palmer treated him using every tool psychiatry had. Nothing helped, until they changed the fuel. It started with a ketogenic diet, not for the brain, but for the body. The goal was weight loss. Palmer didn't expect much, but within weeks, something impossible began to unfold. The hallucinations quieted, the delusions faded, his thinking grew clearer. For the first time in 2 decades, this man could carry on a conversation, cook his own meals, smile, plan, live. Eventually, he tapered off all medications. Palmer was stunned. Schizoaffective disorder doesn't go into remission, he writes in Brain Energy, Chapter 7. Not like this, not from diet. But it did, and that case changed everything. Because ketosis, the metabolic state triggered by a high-fat, very low-carbohydrate diet, isn't just about burning fat. It rewires the brain. In ketosis, the brain shifts from glucose to ketones as its primary fuel. This change reduces oxidative stress, dampens neuroinflammation, and provides more stable energy to neurons. Ketones are not just fuel, Palmer emphasizes. They reduce inflammation, improve brain metabolism, and protect neurons. The result is a brain that runs cleaner, steadier, stronger. For patients with severe, treatment-resistant mental illness, this has become a lifeline. Palmer now uses ketogenic therapy clinically, under supervision, to help stabilize mood, reduce psychosis, and restore cognitive function. It doesn't work for everyone, and it's not a casual diet. It's medicine with rules. But for those who respond, the shift can be life-changing. Because what if the brain isn't broken, just burning the wrong fuel? What if your mood isn't failing? Your metabolism is? And what if healing the mind could start with the way we eat? This isn't a diet trend, it's a revolution. Core Teaching 3. We don't question it anymore. You feel depressed. You get a prescription, an SSRI, maybe 2. If that doesn't work, something stronger. It's the rhythm of modern psychiatry. Symptom, diagnosis, medication. But Dr. Chris Palmer is asking a harder question. What if we've mistaken silence for healing? Because the drugs often do something. They blunt the sadness, numb the fear, mute the edge. But they rarely restore vitality, rarely bring clarity, rarely get anyone back to who they were before the fog rolled in. Most psychiatric medications are putting out the fire alarm without extinguishing the fire, Palmer says. We're silencing the brain's distress signals, but the underlying crisis continues. In other words, the warning signs get quieter, but the damage goes on. That damage, he believes, is metabolic, not emotional, not chemical, not mysterious. Palmer doesn't reject medications entirely. He prescribes them. He's seen them help, but he's also seen their limits and their costs: weight gain, brain fog, emotional flatness, long-term dependence, and too often, no real remission. He tells the story of patients on 5, 6, even 7 medications, still anxious, still depressed, still exhausted. They're medicated, but not well, he says, not alive. And that's the wound psychiatry has stopped probing. Why aren't they getting better? Palmer's answer is uncomfortable, because it suggests we've been treating the brain like a black box. Press this chemical, suppress that symptom, but we've ignored the system that fuels it all. Mitochondria, energy, inflammation, blood sugar, sleep, food. We can no longer ignore the biology behind the behavior, Palmer insists. Because what if serotonin isn't the source of the problem, but the consequence? What if the emotional collapse is rooted not in trauma alone, but in cellular starvation? And what if true healing means not just quieting the brain's alarm, but feeding it what it needs to recover? This isn't a call to abandon medication. It's a call to upgrade the foundation. Psychiatry, Palmer says, needs a metabolic revolution. Not better band-aids, but deeper blueprints. Because you don't fix a burning house by muffling the sirens. You stop the fire. Core Teaching 4. Every bite is a message. Not just to your waistline, but to your brain. Dr. Chris Palmer calls it the food-mood feedback loop. And once you see it, you can't unsee it. Because your brain doesn't just react to emotions, it runs on chemistry, and chemistry comes from food. You can't heal a broken brain with junk fuel, Palmer says. It sounds obvious, but walk through a grocery store and you'll see the contradiction. Shelves stacked with foods that spike blood sugar, inflame cells, and starve neurons. Then entire aisles of antidepressants just across the pharmacy. Palmer draws the line clearly. Refined carbohydrates, sugar, and seed oils destabilize the brain. They flood the bloodstream with glucose. They spike insulin. They inflame mitochondria. Over time, this toxic fuel damages the very structures that regulate mood, focus, and resilience. It's not just theory. Studies show that diets high in ultra-processed foods are linked to higher rates of depression, anxiety, even psychotic symptoms. And people with metabolic syndrome, a common result of poor diet, are significantly more likely to struggle with mental illness. But there's a way back. Whole foods, rich in omega-3s, vitamins, and antioxidants, calm the brain. They fuel clean mitochondrial energy. They stabilize blood sugar. They reduce inflammation. This doesn't just improve physical health. It changes how you think, how you feel, how you respond to life. Palmer explains that when patients switch to a diet rich in healthy fats, leafy greens, protein, and nutrient-dense food, their mood often improves before the weight drops, because the brain feels it first. Food is chemistry, and chemistry drives consciousness, he reminds us. Think about that. Your sadness might not be a flaw. Your anxiety might not be irrational. It might be the echo of a system out of sync, run down by soda, spiked by cereal, scattered by processed oils your brain was never designed to run on. Every meal is a choice, medicine or madness. And most people don't realize they're medicating with every mouthful until it's too late. Contrasts with mainstream. You would think psychiatry, of all fields, would know better than to separate the mind from the body. But that's exactly what it's done. For decades, the dominant psychiatric model has treated the brain like it floats in isolation, disconnected from metabolism, nutrition, inflammation, and the rest of the biological machine it belongs to. When someone suffers from depression, anxiety, psychosis, or mood instability, the system rushes to label and medicate, not to investigate, not to understand. Dr. Chris Palmer sees this as a foundational failure. In Brain Energy, he writes, "We've been treating mental illness from the neck up, as if the brain is somehow separate from the rest of the body. And the results speak for themselves. Rising rates of depression, more suicides, more disability, more people medicated without remission, more lives paused in suffering." Palmer's frustration runs deep, not because he's an outsider, but because he's spent his career inside the machine. He watched the system hand out diagnoses based on symptoms, not causes. A checklist, a label, a pill. The DSM, the psychiatric field's diagnostic manual, is the engine of this approach. The DSM doesn't explain mental illness, Palmer writes. It just categorizes symptoms. It gives names to patterns, but it never tells us why. So psychiatry became a field of symptom management, a discipline more concerned with matching a prescription to a diagnosis than understanding what the brain is actually doing or failing to do. And whenever a clinician dares to ask whether food, blood sugar, nutrient levels, or inflammation might be involved, the field flinches. Many still doubt that something as soft as nutrition could possibly affect serious mental disorders like schizophrenia, Palmer notes. That resistance isn't just intellectual, it's institutional, it's cultural, but it's also indefensible because the evidence is mounting, and not just in Palmer's practice. Research now shows that people with mental illness are more likely to have insulin resistance, gut dysbiosis, nutrient deficiencies, and poor mitochondrial function. These aren't coincidences, they are connections, but the system still separates them. A patient can walk into a psychiatrist's office with prediabetes, inflammation, and sleep dysfunction, and walk out with a new antidepressant, but no discussion of glucose, food, or sleep hygiene. That's not medicine, that's neglect. Palmer calls for a metabolic revolution. He wants psychiatrists to run lab tests, ask about diet, explore blood sugar curves, and treat the body as part of the brain's recovery. Because the mind is not a mystery, it's biology. And we've let generations of people suffer because we refused to see that. We told them their illness was genetic, or lifelong, or purely psychological, when in fact, it was also metabolic. People are suffering, Palmer says, and they have no idea that what they eat or how they live could profoundly affect their minds. That's not just a gap in science, it's a moral failure, because if a patient's despair is fueled by insulin resistance and no one checks, if their anxiety is triggered by crashing blood sugar and no one cares, if their hallucinations respond to ketones and no one dares to try, then we've built a psychiatric system that forgot what it was meant to do: heal. The tide is starting to turn. Clinics like Stanford's metabolic psychiatry program are emerging. Researchers are testing dietary interventions for schizophrenia and bipolar disorder. But it's not enough. Not fast enough. Palmer is one voice, but his message is growing louder. The brain is not floating above the body. It is the body. And it's time psychiatry remembered that. Real-life applications of Dr. Chris Palmer's teachings. She had lived with bipolar disorder since her teens. Mania that left her sleepless for days, spending sprees she couldn't remember, crashes so dark she couldn't get out of bed. Medications blunted the extremes, but also her spark. Years passed, dosages increased, side effects piled up. The doctors said this was as good as it gets. Then came the lab work. Her blood sugar was a mess. Insulin resistance, chronic inflammation, vitamin deficiencies. She wasn't just mentally unstable. Her metabolism was collapsing. Dr. Chris Palmer saw the pattern. Instead of upping her meds, he changed course. They cleaned up her diet, removed sugar, stabilized her blood glucose, added omega-3s, B vitamins, magnesium. She started walking every morning. Slowly, her energy returned. Then her clarity. Then her joy. No more extreme swings. No more fog. For the first time in decades, she felt steady. Not because of a new pill, because her brain had fuel. Then there was the man with obsessive-compulsive disorder. He washed his hands until they bled. Couldn't sleep unless every light switch had been flipped in a perfect pattern. He'd tried every medication, every therapy. Nothing touched it. Palmer recommended a ketogenic diet. The man was skeptical. How could fat help his mind? But he was also exhausted. So he committed. Measured meals, medical supervision, full compliance. After 6 weeks, the compulsions faded. The fear shrank. He started sleeping through the night. He got his evenings back. He got his life back. Or the woman with chronic depression, diagnosed at 14, treated for 2 decades, still miserable, overweight, fatigued, hopeless. Palmer discovered she was pre-diabetic. Her gut microbiome was a disaster. He didn't give her a new drug. He gave her a new protocol. Whole foods, low carbs, daily sunlight, targeted supplements. 3 months later, she was hiking. 6 months later, she was smiling. Palmer has seen this again and again. You don't need to understand every mechanism, he says. You just need to heal the system. And the system is the metabolism. Mitochondria don't care about labels. They don't distinguish between depression and anxiety. They care about fuel, about inflammation, about blood sugar stability. When those things fall into place, the mind often follows. But let's be clear, this is not easy. These recoveries aren't miracle stories. They're stories of discipline, of structure, of letting go of comfort foods and leaning into biology. No one wants to believe that their pain could be coming from their plate. But when you see someone go from suicidal to stable because they swapped sugar for fat, because they started sleeping, because they gave their body what it needed, you can't ignore it. Not anymore, because healing doesn't always come from more medication. Sometimes it comes from metabolic repair. And that takes work, but it works. What if your sadness isn't who you are, but what your cells are screaming? What if the fog in your head, the heaviness in your chest, the dread in your mornings isn't a flaw in your mind, but a malfunction in your mitochondria? Maybe you've been told it's just anxiety, just depression, just something you have to live with. But pause for a moment. Are you always tired, no matter how much you sleep? Do you crash after meals? Do your thoughts feel slower than they used to be? Do you snap, spiral, or shut down, and you don't know why? Do you numb yourself with caffeine or sugar just to feel something? Because beneath all of that, there might be an energy crisis. Your brain is not broken. It's exhausted, undernourished, inflamed, and your symptoms, those terrifying, disorienting, crushing waves, might not be mental at all. They might be metabolic. Dr. Chris Palmer puts it clearly. Mental illness is not your identity. It's a signal. A signal that your brain is running out of fuel, that your mitochondria, the tiny engines behind every thought and feeling, are sputtering. And no amount of positive thinking can override that kind of failure. But here's the hope. This isn't permanent. You're not powerless. You're not defective. You are a system, and systems can be repaired. What if healing doesn't start with a diagnosis, but with your next meal, your next walk, your next quiet decision to give your brain a better fuel? This isn't about blame. It's about biology. And if your mind has been whispering that something is off, maybe it's time to listen, not with fear, but with a quiet kind of power. It was never just in your head. It was always in your cells, in the way your brain breathes, burns, and heals beneath the surface of thought. The shift begins here. You are not broken. You are underpowered. And every choice from here on is a chance to feed the system that feeds your soul. If this video helped you see things differently, if it gave you something real to hold on to, know that it came from hours of care, intention, and deep belief in the power of true understanding. Your support means more than views. It fuels the kind of content that dares to go deeper. And if you felt something today, you'll want to be here for what's next. We're just beginning to uncover what healing can really look like. Stay blessed.